Hello, and welcome to The Public's Health, the show that puts you, the public, back into public health. I'm Dr. Tony Iton, Alameda County Health Officer and Public Health Director. Today we're dealing with an interesting subject, one that sometimes is very confusing for people. And we're joined by Dr. Muntu Davis, who's the Deputy Health Officer in Alameda County for Emergency Preparedness. And we're going to talk a little bit about disaster preparedness and some aspects of communication. Welcome, Muntu.
Thank you.
Now, you're the guy in Alameda County when something goes wrong that relates to public health that's really responsible for ensuring that we have an appropriate response and that our response is a kind of response that's efficient and timely and helps people get the kind of information that they need. Tell us a little bit about what that entails.
Well, you say I'm the guy. I'm the guy that helps to coordinate a lot of folks getting involved in a response. In terms of responding to things, it takes a lot of different agencies partnering together in order to actually do what it is that's to be done in order to decrease the effects of an emergency. So from the public health standpoint, what we try to do in that is we try to make sure we know what's happening in terms of what's happening in the environment or to people's health and what impact something could have. Then we try to figure out exactly what it is we need to do and get that message out to the public or to our partners so that they can get it out to everyone and we can try to decrease the effects of whatever event it is.
So really, you try to figure out what it is that the threat is, how to stop it if we have tools and that kind of thing to stop it, and then communicating with people to give them the information that they need in order to protect themselves or to respond to the various authorities that might be giving people instructions as what to do. Now, it's a big mess, a lot of acronyms. You've got police, you've got fire, you've got hospitals, you've got doctors, you've got ambulances. How do you bring all that kind of stuff together and make sure that people are talking on message?
Well, there's been one concept thrown around, and it's called the Joint Information Center, or also known as a JIC. The important thing about that is to understand that it's really how we're working together as multiple agencies or entities, community-based organizations or physicians, and trying to understand, one, where all the information is coming from, two, verifying whether or not it's true information, because that's one of the biggest concerns in an emergency, that a lot of false information gets out.
Okay, well let's see what a JIC looks like.
Okay. We had a Joint Information Center drill, which was held in February of 2007. And the idea is that during an emergency or a disaster, the information that comes out to the public has to be consistent, has to be accurate, and has to be timely. And it also has to take into account information coming from a number of different places. The intent of this was not really to make this as realistic as possible, but to get people familiar with how public information officers will work all together in one room, dealing with lots of information from multiple sources. So the Joint Information Center drill was really to get those folks in the room that would be involved in that and to sort of go through the processes and the protocols on how that would be done. In terms of my role, I played the health officer for the public health department in their Department Operations Center, which would be connected with the Joint Information Center. And when questions came in regarding either what was going on or that had to do with instructions to be given to the public, I gave that information and the Joint Information Center processed it alongside with questions that came from both the public as well as other agencies or organizations or even from our department as to what was going on or what we were seeing. So what they would do with that information is they would take it, they would process it, try to make it into something that was simplified enough for the general public to understand and make sure that it covered all the information that we thought the public would need and pull together either the media personalities or the press, all the reporters, as well as use their normal outlets for getting that information out to the public. One of the big things that the Joint Information Center does is it also is a place to coordinate all press conferences. So as the press is asking questions about what's going on or wants to speak to certain people who are involved in the response, the Joint Information Center will try to make sure that the appropriate people can be identified and scheduled and then have everyone come to one location versus having to run all over the place during an event, as well as having those who need to speak have to stop what they're doing in their locations or interrupt activities or response measures in locations that they can come to one location and meet all the press at one time, so so it's all coordinated. So it's not just one news company coming every hour or every 20 minutes. So the Joint Information Center drill tries to coordinate that so that it gives some orderly fashion to how information both comes in, gets processed, and how it goes out. And as we do more drills, and we intend to do more regarding the Joint Information Center, they'll get more complex.
So that's a JIC, a Joint Information Center. A lot of really important looking people running around in a room. You've got public information officers, you've got all these agencies working together to try to coordinate a message. So it's really about communication, communication, communication. Is that pretty much what we're talking about?
It is, but it's not just communication, but it's accurate and timely communication to tell people what to do and what's happening so that it's a clear message and a single message so there's no confusion.
So we hope that the public will get a clear message and that they can look for the JIC to essentially broadcast out the kinds of instructions that all of the agencies agree are the things that people should do. So there isn't that conflict. Is that what it's about?
Yeah, and the JIC is really what happens behind the scenes. So it's before the message actually gets out. It's the work that goes on behind it to make sure that it's an accurate and timely message.
Excellent. Now, one of the other responsibilities, amongst your many responsibilities, is ensuring that if, God forbid, there's an event and there's a need to get either antibiotics or vaccines or some other what we call medical countermeasures out into the public very quickly to try to avoid people becoming ill, you're responsible for setting that up. Tell us a little bit about what we're going to see in the next clip, which is the Camp Parks drill.
Well, one of the things we do is we coordinate with other agencies in order to help us, do the things that we need to do to protect the public. And so what you're going to see is an exercise that we did with Camp Parks, which is a federal agency, how we worked with them in order to help us provide vaccinations, mock vaccinations to their population that reside on the base. And so what you're seeing here are some mock injections. There are no needles, but this is just going through the motions of what actually would happen during an event.
So the idea here is that we would have the vaccine, we would deliver it to them, and they would essentially manage their population that they're responsible for with respect to getting them vaccinated?
Yes, and that's exactly what it is. And we work very closely with them in order to help them set that up and to get through and do the things that need to be done in order to protect their population. It's one of our biggest things that we do in terms of partnering with people to help protect the public.
And this is what you refer to as a push site, where basically you just get the stuff to them and they take care of their population. We also have pods, which are points of distribution, and where the public would come to get vaccines or antibiotics and the like. And obviously we have a big warehousing function to receive all of these countermeasures and then distribute them throughout the impacted area. Is that right?
That's true. I mean, there are a lot of steps that go into what you actually see, a lot of stuff that happens behind the scenes, and there are multiple stages to get it all done.
Okay, well, let's take a look at the Camp Parks drill.
About 9 months ago, I went to a Alameda County pandemic flu information briefing at the Alameda County Sheriff's Office, and we jointly conceived of the idea of trying a point of distribution pod, which would serve only the Camp Parks residents that are living on the post and all of the employees, civilian and soldiers who are working on the post day to day. And that number fluctuates up to 2,000. So the idea that the county had was to push a vaccine, in this particular scenario, the avian influenza pandemic, to Camp Parks. We see this operation today, the first time it's been done with the military in Alameda County, and the first time any of us here have been involved in this type of training exercise. And we see it as an opportunity to plan to save lives. That's what the bottom line is.
Today I brought 27 students here to participate as role players in the exercise being held here on Camp Parks. It's a joint collaboration between Camp Parks, the U.S. Army, and Alameda County. And as part of junior ROTC, our students learn citizenship skills. And what better way to become effective members of the community than to understand how the community responds in a crisis. And so I thought this was a great opportunity for them to come down and mix it up with healthcare professionals, soldiers, community members, and see exactly how the community takes care of its own in an emergency.
When we do an event such as this, we bring a cadre of staff from the Center of Public Health and Disasters. Our staff are all trained, at least master's level trained in public health, and have been working in this field for a number of years. We develop a questionnaire. They're open-ended questions, and they're looking for whether or not the staff that are working in this pod site were able to fulfill their roles based on the training that was given them. So we're really looking at the effectiveness of the training so that the pod staff could do what they were supposed to do. So it's actually sort of a two-level evaluation that's going on. Can they do their job, and can they do their job because they got the right training to do that job in a just-in-time fashion? We've been working with Alameda County's Public Health Department since the fall of this last year and helping them to design this exercise, as well as a couple others that we've done in the past few weeks here in the county. This is a great exercise. It gives the county an opportunity to work with an organization like the military that is very well trained and is very well developed, and help them to refine their processes so that they can work with other organizations that are not quite as advanced and well developed in being able to respond quickly to emergencies like the military is. I think that this is going to take both this military installation as well as the county quite a ways in helping them to better respond to the needs of the county here in Alameda.
Wow, a lot of coordination involved in that. But seriously now, all of this is going to help us avoid a Hurricane Katrina type of scenario in Alameda County?
It will, but we have to get down to the community level, all the way down to the neighborhoods, and get the public involved at the community level in helping us to prepare for all of this.
Excellent. Thank you very much, Dr. Davis. And now, for something completely different, we're going to talk about sugar. The coming tsunami of obesity that has reached our shores has not yet stopped. And unless we do something about the amount of calories we consume, we're going to be digging ourselves out of this mess, a real disaster, for years and years to come. Well, as many of us have heard, the rates of obesity have been skyrocketing. In our school systems, we see anywhere from 1/3 to 40% of the kids that are frankly overweight and at great risk of becoming obese adults. In fact, data suggests that a child at the age of 6 who's overweight has a 50% chance of becoming an obese adult. That's 1 in 2. And if by age 12 a child is significantly overweight, that chance of becoming an obese adult is almost 80%. So our opportunities to intervene, to change this tsunami, if you will, are really early in the life of a child and the lives of families. So one of the things Alameda County Public Health Department has been trying to do is work very closely with schools and with preschools to try to set kids on the right course. This summer we're going to be engaging in a soda-free summer, which is a campaign, a pledge for kids and families to sign up and say, you know what, I don't need this added sugar. I don't need to have soda all summer. I'm going to drink water, I'm going to exercise, I'm going to avoid things with added sugar. So just to prove to you that sugar is all around us, this next segment is going to show us just how much sugar is added to all of the foods that we see on a daily basis. Hope you enjoy it, hope you learn something.
First question, is there any particular food that you eat more often than any other?
Breads.
Eat a lot of salmon. So I guess I eat it and chicken more as far as meat.
I like pasta.
We like pastas and salads, yes.
I would say chicken a lot.
I think I eat salads most.
And also I eat a lot of frozen dinners.
Fruit more than probably any other.
Do you think that's a healthy food for you? Why or why not?
Not as healthy as I think that a lot of the other, fruits and vegetables, but bread is a caloric. I'm kind of a high calorie burner, so I kind of like the idea that they kind of have, everyone likes the idea that they want low calorie food, but I burn a lot of calories, so I figure that's not as bad for me.
Maybe the chicken isn't quite as healthy as I once thought it was, but still I think it's more safe than a lot of the other meat.
It is, I think, if you go with the wheat pasta.
Especially the salads when you have them organic, and it would also be the best to have the pasta organic.
Is that a healthy food for you?
No, I know it's not. But
Why?
It's, it's very greasy, so.
They're mostly spinach salads, and I put a lot of stuff on them, meat and other good vegetables.
Lean cuisines, which I know has a lot of sodium in it, but I still eat them.
Yes, it
And
is.
why?
Because it has natural sugar in it.
And what do you think you could do to improve your nutrition?
Always fruits and vegetables, smaller portions.
Not eat as much sugar.
I think I should eat more fruits.
I could leave the candies stand a bit more, so to speak.
As far as like cutting out the fatty foods and I eat a lot of snacky food, so.
For some reason, it's so hard to get fresh fruits, carry them around. They expire quicker than vegetables.
Not eat as much sodium.
Exercise more so it changes my metabolism so I eat more healthy.
How many pounds of sugar do you think the average American consumes in a year?
5 pounds? I don't know. 2 pounds?
Maybe 20 pounds of sugar.
20 pounds, about 25.
Maybe like 50 pounds.
50 pounds.
Say about 400 pounds, maybe?
Oh, a year? Oh, probably thousands of pounds.
I think they consume way too much.
Wow, that was quite a variety of opinions we saw there. So, what are the facts?
They're not even close. Actually, the average American eats 175 pounds of sugar a year.
175 pounds of sugar a year.
Right, which is about a half a pound a day. So this is a half a pound of sugar. It's 64 teaspoons of sugar. And that's what the average person is consuming every day.
Where are we getting all this sugar?
Well, most of it is coming from sweetened beverages, and so I want to do a little something with you. This is a 20-ounce container of a beverage, and the label, and I've already done the math for you, tells us that it contains 17 teaspoons of sugar.
Wow.
So I want you to put 17 teaspoons of sugar into this bottle so we can see what that looks like.
Right now, right here?
Right, and I'll help you count.
Thank you. Oh boy.
Push them in there. 1, 2,
2,
3, 4, 5, 6. You are not even halfway. 7, 8, 9, 10,
11.
And you still got 5
12,
more to go.
13, 14, 15, 16, 17.
So take a look at that. That's how much sugar is just in this one beverage container.
I gotta say, I'm disgusted. That's gross.
Okay, so let's set this over here and talk about some of the other places that sugar comes from, because it's not only from the things that we drink. And a lot of people will say, well, I don't drink soda, so I'm cool, and not a problem. But it's coming from a lot of the packaged and processed foods that we eat too. There's a lot of added sugar in processed food, and some of them have quite a lot of sugar added to them. So let's take, for example, a breakfast cereal. So I want you to pour into this bowl just the amount of cereal that you think a person might serve themselves for breakfast in the morning.
The typical American person?
Yeah, I mean, this is your breakfast cereal bowl. How, fill it with what you would normally serve yourself.
Now, I don't eat this stuff, so it's not me.
Okay.
All right.
We're talking about the person that has half a pound a day.
I'd say probably something like that.
Okay. So I'm going to look at the label on this box. And the label tells me that 1 serving of this cereal has about 4 teaspoons of sugar in it. And 1 serving is 1 cup. So let me show you what 1 cup is that much.
Wow, so this is probably almost 4 times that.
Yeah, what you poured in there, and I measured beforehand the capacity of that bowl, is about 3 servings. So this bowl of cereal has 12 teaspoons of sugar in it.
Well, who determines what a serving size is anyways? It doesn't seem to me like people actually eat that much cereal when they serve themselves.
So the food manufacturers actually determine what a serving size is. And in cereal, it can range from a half a cup to a cup. And that is, it's really their determination, but the nutrition information on the label is all related to the size of that serving. So that's why I could look at that box and tell you that there are 4 teaspoons of sugar in this serving, which is
probably 16
probably
or so.
less than most people would serve themselves.
I would say almost certainly. But don't we need sugar, Darlene? Isn't sugar an important calorie source of calories that we need to have energy and be alive?
It is a source of calories, but we don't need the added sugar. We get enough sugar from the carbohydrates and the sort of foods that we eat during the day without having all the added sugar from these products that we're buying.
So it's the additional sugar that the manufacturers put in to sweeten up the flavor to get us to eat more of it.
Exactly. And that's how we get to that half a pound a day.
Wow.
So you're going through your day. Now we've seen, we've had a drink, we've had breakfast, and let's say it's the afternoon and you're going to take a little break from work, get up from your desk, go down to the vending machine and get another something to drink and a snack for yourself. So not an uncommon kind of afternoon snack for, you know,
sure, a
for your afternoon break.
Pick me up in the afternoon.
Right.
Keep those brain cells functioning for the rest of the day.
So we have already seen how much sugar is in one of these, 17 teaspoons. And I'm going to look at the label on the back of this package, which tells me that this snack has about 12 teaspoons of sugar in this bag. And I can tell it because the package will tell me grams, and there are 4 grams of sugar in 1 teaspoon.
Okay.
So we can figure that out. So there are 12 teaspoons of sugar.
A cube is a teaspoon.
A cube is a teaspoon.
And there are 4 grams of sugar in this cube.
Right.
Or in a teaspoon. Okay.
Right. So this package has 12 teaspoons of sugar in it. So let's look at what we've had so far. We've had 2 drinks, we've had breakfast, and we've had a snack in the afternoon. We've had altogether 58 teaspoons of sugar.
Wow.
And the half a pound is 64. So if you think that it's really almost unimaginable we could be eating that much sugar, we're very close. And if you look at what we've had,
and we haven't had dessert yet.
and we haven't eaten anything that really has a lot of nutrition in it. We've had, 2 sodas, some cereal, and candy, basically. So the rest of the day, we may have another one of these products and really push us over the edge, and then we're even ahead of that average American who eats the half a pound a day.
So what do people need to know about this? How do they protect themselves from all of this added sugar that's in so many of the products, in some ways, in ways that we don't even suspect it or know?
Well, the best thing to do is to eat fresh, whole food like fruits and vegetables, and stay away as much as you can from all of the packaged and processed foods. And, as a beverage, drink water. Water has absolutely no sugar in it. It's the best thing for our bodies as a drink, and you can replace at least one of these with water. I want to tell you that, and you may be surprised to know, drinking 1 20-ounce sugared soda a day, every day for a year, will cause you to gain 26 pounds in a year.
26 pounds?
Just from the calories that are in
from
this.
One of these a day for a year is 26 pounds.
26 pounds.
Oh my goodness. How much exercise would we have to do to get rid of that?
Well, a lot.
Yeah.
And that's the other recommendation, is to get some regular physical activity. 30 to 60 minutes a day would be optimum, but any physical activity will help. And we can sort of fight the effects of all of this sugar that we're having.
Now, I understand Alameda County Public Health Department is doing something very exciting this summer to try to educate our kids about all of this. Can you talk a little bit about that?
Right, so we are launching a campaign for a soda-free summer for Alameda County.
Soda-free summer.
Soda-free summer. So you know that 26 pounds that you might put on, you might want to take that off.
Sounds interesting. What is that?
So what we are trying to do is we really want families and residents of Alameda County to start living healthier lives, and setting down the soda can be the first step towards making a change that will really make quite a big difference. I'd love to come back in 2 months when we have all of our campaign materials ready and tell everyone how they can participate with us to be soda-free this summer and, you know, take that step, start to be healthier. So we invite everyone to join us and have some fun while we do it.
Wow, that sounds interesting. So you'll be asking kids to actually pledge not to drink soda for the summer.
Right. And their families.
And their families.
I think it's a great thing for a family to take on.
Wow, that's a great idea.
So we'll have games, we'll have contests, we'll have prizes. We're going to make it a lot of fun, and we'll get Alameda County healthier.
Well, I think that's an exciting idea. Now, some of these products in the last minute that we have are products that many of us have on a regular basis, either on a weekly basis or in some cases on a daily basis. Anything that you can say to people about substitutions that they might want to think about for some of these products?
Well, you know, it's unrealistic to think that people are going to cut all of this out at once. And so if you're eating something on a daily basis, you might want to think about having it twice a week or cutting back on that, and then replace it with something like fruits and vegetables, or something that's fresh food rather than something that comes in a package.
Very good advice. So there you have it. And Darlene Fujii Pratt from our Nutrition Services program is available to answer questions and stay with us.